On 0786 10 11 12. It is NRN Radio 786, a little bit after 8 o'clock. Our attention now turns to the Child Protection Month that we are currently in. Since January of this year, 155 children under 5 have died in public health facilities with severe malnutrition as an underlying condition. Experts and advocates are now calling for urgent multidisciplinary action to be taken to prevent this from continuing to happen. Let's bring in a guest with us this morning, Katie Pereira-Kotse, a dietitian by training with a PhD in public health. She's also a part-time research consultant with the South African Medical Research Council, working on advocacy and policy for infant and young child feeding and nutrition. Also on the line, Dr Petronell Kruger, a programs manager at the Healthy Living Alliance. A very good morning to you both. Thank you very much for your time. Katie, let's start off with you. When we hear of 155 children having died in public health facilities with severe malnutrition as the underlying condition, what does that practically mean? Are they dying because they're starving, they're hungry, or that they don't have the sufficient amount of nutrients with which to be able to keep them alive? Good morning.
Morning. Thanks for having me. You can hear me all right?
Yes, I can.
Great. Yeah, this is a really, serious conversation we're having. And as you said, are they dying of starvation, not having enough food? So with malnutrition, the immediate or obvious cause is insufficient food and nutrients. But there are many underlying causes why a child might not be getting that food and nutrients. And in a country like South Africa, challenges like high rates of unemployment, low family incomes, poverty mean that households might not have enough food to provide everyone, and then infants and young children are vulnerable groups at higher risk. But new mothers as well, we should be supporting them to breastfeed from the beginning, and there's many challenges women experience with breastfeeding, for example, and a lot of these malnutrition cases happen in young children. And as I mentioned, low incomes and unemployment, women are often needing to get back to work, aren't able to access paid maternity leave, for example, so that they can be home to care for their young children. So while it might seem like it's insufficient nutrients or not getting enough food, there are these underlying causes. And then we do have programs in South Africa from health facilities that provide nutritious supplements. So there's nutrition supplementation programs, but often families and mothers and parents face challenges in accessing these programs, in getting to the clinics, in accessing support like the Child Support Grant. So there are many complex reasons why something like this should be happening. But the bottom line is, in a country like South Africa, 30 years after democracy, and we're an upper middle income country with a substantial GDP, this should not be happening.
Yeah, I mean, it shouldn't. Are we saying that, some of these kids are dying purely because they're poor? The environment from which they come, they're confronted, of course, with hunger, poverty, sometimes spread of disease, and so on and so forth, that as it stands right now in South Africa, there are children dying because they simply don't have enough food to eat, or that they don't have, and aren't getting sufficient nutrients. That yes, while there are, I suppose, differing factors from child to child, there is a very real scenario as we speak right now that there are kids that are so malnourished on account of a lack of food and supplies and that sort of thing, on account of their social standing.
Yes, and as you said, it's complicated. There's various reasons. So if we look further downstream, the price of food, often unhealthy food is cheaper, and healthy food, fruits and vegetables, is either more expensive or not available close to where people live. So a combination of that, and then, as I was mentioning, we do have health services and clinics and programs that should be picking up children before they get to the point of being so malnourished that they might be dying due to malnutrition. But if we start looking at other factors, the health service and health workforce, we don't have enough health workers. We don't have enough budget to ensure that there's enough staff or community health workers going out screening children at the appropriate times, reaching them where they are. They might be at a creche, or they might be at a household, but the mother might need to go to work and she can't afford to take a day off to take the child to the clinic so the child can be checked before it gets to the serious state of dying from malnutrition. So there's many interrelated and complex reasons why this is happening.
And I was going to get to that now with Dr. Petronell Kruger, also on the line with us, the programs manager at Healthy Living Alliance. Surely that if an infant is dying of malnutrition, I would suppose that infant hasn't been able to get access to a clinic where the routine assessments are done even after birth. That kids have to go to these assessments with which to determine whether they are healthy, they are not malnourished, and are not in harm's way. Because if they are being assessed, I'm certain the healthcare professionals would have to then keep that child until the child so does stabilize. And the fact that there's 150 of these kids that have already died means that those kids aren't quite getting any clinical assessments, Dr. Petronell.
Good morning, and thank you for having me. Yes, and you're saying 150 children, but I actually think that number is probably underreported. So usually we see about 1,000 direct deaths due to what we call severe acute malnutrition. And we actually know that 1 in 3 child deaths are attributed either directly or very closely to malnutrition. So even the minister's numbers, I think, might be a little bit underreported. And frankly, this is the type of thing we see in war zones. So, we're saying, do these children go to clinics? Are they being assessed at clinics? But the stark reality is that our health system is so broken at the moment that, firstly, it's very difficult for parents of lower socioeconomic bands to access clinics. It's particularly inaccessible if you're in a rural area. But also, the healthcare workers oftentimes don't have access to very basic things. We see every year that there's a report in major hospitals in what should be more resourced areas saying things like they don't even have food to give to people, recovering from heart surgery. So that becomes really difficult, where we're seeing that we effectively need to have a humanitarian intervention in our hospitals.
Yeah, because even being at the hospital doesn't quite always mean that the child is getting the attention that they so do deserve. Are there sufficient government programs, through public health that's available, for there to be an outlet if a kid is suffering because parents and the environment from which they come, they do not have food, they don't have formula, baby formula and other bits of food to give, to ensure that the child gets the nourishment that they so do require. Is there an opportunity for them to find that available within public health at the moment, Dr. Kruger?
Yeah, the real intervention that we need on that is actually within the Department of Social Development. I know, especially middle-class South Africans, it's a difficult conversation because we have maltrust in our government, but we need to have an understanding that social grants are life-saving. And the real intervention here, because as you said earlier, you asked the question, and I think quite astutely, is are children dying of poverty? And the answer is just frankly yes. And the reason, or the way in which you address that in a country of high inequality and very low employment rates is through a grant system. And that's something that, we need to develop a level of comfort with and understand that, if we have a well-functioning social security network, that's a net positive for everyone. That is a boon to the economy. It reduces crime rates, and we don't see things like we're seeing now, which is very avoidable child deaths. And I just want to, and I'm sure Dr. Pereira Kotze will speak about this a little bit more, but especially in this instance, a really effective intervention is just more public health information on the benefits of breastfeeding. And I'll definitely let her speak to that a little bit more because that's her field of expertise. So, the children dying effectively reported in the stats are children under 18 months, the bulk of those children. And at that rate, we should be asking ourselves, why they're not getting adequate nutrition.
Yeah,
for breastfeeding.
where's the mother to be able to breastfeed the child? Let's go there very quickly. Doctor could say, why do you think, I mean, under 18 months is quite a shocking figure, and if they're dying because they're malnourished and, on account of poverty being a factor here, I don't know, are the mothers not around? Are the mothers at work? Is there just not a strong culture of breastfeeding in some of these instances? What have you been able to determine?
Yeah, so as Dr. Kruger was saying, I mean, if the public health recommendation is children should be exclusively breastfed until 6 months. So if that was happening, children would be well nourished, they would have food security up to 6 months, and then we also recommend continued breastfeeding up to 2 years and beyond. And even after 6 months, breast milk will provide a good amount of nutrients, quantity and quality for that child that will contribute to them getting enough food. But we have low rates in South Africa due to many reasons. The fact that women have to go back to work early because they can't access adequate paid maternity leave. The fact that often mothers might send a child to live with another family member while they go to find work. And in those situations, there are programs in place. So you were asking, what are there government programs? So the Department of Health has nutrition supplementation programs where fortified milk and fortified porridge is available to vulnerable groups, including breastfeeding women. So if the breastfeeding woman doesn't think she's getting enough food, she should be able to access these supplementation programs, and infants and young children. But as Dr. Kruger mentioned, there are challenges in the health system, and often facilities might run out of stock. And this goes back to the kind of priority that government and society gives to health and infants and young children and pregnant and breastfeeding women, and that we need to shift our mindset a little bit, because this is a time during the life cycle where if we ensure proper nutrition and health, it would ensure adequate growth and development. And if we look at the business case, it would ensure returns on investment for years to come. But we're in such a mode of, fixing other problems and looking at other things, immediate things, not seeing these problems until they happen, that we're not getting the basics right. So again, looking at the structural issues, and Dr. Kruger mentioned the child support grant. We know there are millions of families that are not even able to access the grant. And why is that? So if we look at what happens when a mother has a baby, she has a baby at a health facility. She has 30 days in which she needs to go to the Department of Home Affairs to register her baby and get a birth certificate. Now, this is a woman who's just delivered a baby, who might have no money because she doesn't have paid maternity leave. She now has to go and stand in a queue for a day, pay to get there, to get the birth certificate registered, before she can even then go to the Department of Social Development to apply for the child support grant. Now, why are we not using technology that we have to ensure that all these government departments are linked? Why can't the Department of Health have an online system that links to the Department of Home Affairs and Department of Social Development, so that we're not putting the burden on that woman who is trying to care for her child, trying to get back to work, and the burden often falls on women. And I think of things like in South Africa, we have a very efficient, SARS e-filing system. Government has got examples of where they do things efficiently, but the priority is not being placed in the right area, in my opinion.
Yeah, and I think it's a very strong indictment, on all of us, that essentially it comes down to kids that are dying because of poverty, that shouldn't be the case, and I mean, there's several sectors here that can play certainly a role. I do want to look, though, at some other corresponding data, Dr. Kruger. We have here, and I'm looking at a statistic put in front of me that says that there is, though, a growing prevalence of childhood obesity, that nearly doubling in recent years. We see scenarios in which, other than, malnutrition and stunting, that there's an intersection here where obesity is also a particular challenge. And I want to then understand whether this is, again, a problem of a different kind in the opposite direction, where there is again, not proper nutrition and not proper dieting and that sort of thing that develops, a different set of health problems altogether, and then how then to understand, this other emerging trend. Dr. Kruger?
Yes, sorry, my line's being a little bit weak, and you'll just let me know if I'm breaking up.
Okay.
But, yes, we actually in South Africa have double the rate of childhood overweight and obesity. And I think that's important for us to understand that childhood overweight and obesity is not in contrast with things like stunting and undernutrition, and let's just call it what it is, hunger and child starvation. But it actually effectively plays on the same court. And the reason for that is, we're talking about malnutrition in a lot of instances. That means families are giving children energy-dense food to try and make up for the deficit in a child's diet. And that means children are eating effectively empty calories and things that are pumped with sugar and bad fats and salts. And there's a pipeline. So you have a hungry child. The child effectively becomes an overweight child, and oftentimes then an overweight teenager and adult. And we see now that 1 in 2 South African adults are overweight or obese, and then develops chronic diseases like diabetes, where we have 1 in 9 South Africans having diabetes. And the reality is we have in one household someone reporting food insecurity, in the sense that they're hungry and malnourished and children are stunted. And we have adults in that same household who are obese and who then have these chronic diseases. And that's not because that the adults are not, in fact, doing their best to take care of the children. In fact, we see mothers during times of great hunger participating in something called shielding, which is where they would give up their food to rather feed their children. It's simply just the body adjusts to being chronically hungry, and the diets are adjusted by people by effectively introducing what we call ultra-processed foods, which we shouldn't call foods because it's rather products, because it has very little nutrients.
And maybe if I can just come in there, if you don't mind.
Sure, the line there too, Dr. Kutse, started fading to the end. Dr. Kruger started fading there to the end, so we will try and work on that. But Dr. Pereira Kutse, you wanted to come in?
Yeah, to say that you have this situation where there's undernutrition and underweight and stunting in children in the same household where there's overweight children and overweight and obesity in adulthood. But it is also a cycle where if a child is undernourished in the first, up until 5 years, so infants and young children, then it actually changes their metabolism and reprograms their hormones and physiology to almost move into a mode where they hold on to energy, and there's metabolic processes where an undernourished child that is underweight and low height for age, so stunted, has a higher risk of becoming overweight and obese in later childhood and in adulthood, and then developing diabetes, high blood pressure, cardiovascular disease, which are all conditions that are very common in South Africa. So again, if we go back to focusing on ensuring adequate nutrition during pregnancy, so even from when a woman is pregnant, and this also extends to social support. So some of the work in campaigning has been that pregnant women should be receiving a support grant. So we should be extending the child support grant so that women receive it during pregnancy already, to ensure that they are adequately nourished, because if a woman is undernourished and doesn't receive enough nutrients, she can give birth to a baby early, premature baby, and also a baby that is low birth weight, and that baby then has a higher risk of undernutrition in the early years, but then also developing overweight and obesity later on in life. So it's all interconnected, and we need to be changing the way that we look at this and where we are investing our resources. And again, problems like this happen. We're talking about vulnerable groups. Children can't advocate for themselves and go and speak to politicians and say that they're not able to access social services. So we need to be doing that for them.
Yeah, I want to just quickly, and that there, the voice of Dr. Katie Pereira Kruger, a dietitian by training with a PhD in public health, also part of doing some research, with the South African Medical Research Council, working on advocacy and policy for infant and young child feeding and nutrition. Also on the line is Dr. Petronell Kruger, the programs manager at the Healthy Living Alliance, talking to us this morning. I want to maybe and perhaps deal with the next, I suppose, a sensitive issue, which I'm certain some listeners will raise, and that is that they do believe that you have, mothers and fathers, because it takes two to tango, but you have largely mothers that are birthing children, or making children, and oftentimes they would claim that this is for a child support grant that is abused and not used for the child. And then you see neglect as a feature for why the child is oftentimes malnourished. And this happens on some Cape Flats communities where, again, poverty and substance abuse and so on and so forth, is a very real challenge. And so not to get all judgmental about things, some would point out, Dr. Kruger, and I'll put this to you as well, Dr. Pereira Kruger, but let's start with Dr. Kruger, that we're dealing not just with a lack of food problem here. We're dealing with as you put it earlier, a social development crisis within which you have, dependency on income grants that aren't quite used for the kids. And by extension, sometimes, drug abuse and those sorts of things as a dependency issue that causes the child to be neglected. And therein, it's not just a matter of whether there's food or resources available. It's about fundamental neglect. And I'm wondering how much of a factor really that is, or whether that is really small in comparison to the more broader trends and patterns that you're observing. Dr. Kruger? Dr. Kruger?
Yeah, I mean, that's an interesting question, because we hear this discussion oftentimes when we have, the sort of debates about social grants. And we have seen some studies in the South African context, and then a lot of evidence from sort of comparative countries that have a similar system that largely debunks this, that shows that, there's very little motivation for parents to actually have children to access the grants. And that's just a simple sort of economic sum that people do. It's very little. A child support grant is just over 560 now, which the sort of average person can calculate, even if they are nefarious and they do this for the wrong reasons. There's just no benefit in it. And I'm sure, there's always going to be one or two illustrative anecdotes that people can point to. And in a country like South Africa with very high rates of drug abuse, we are definitely seeing worrying rates of childhood neglect. But I think for the average South African who's struggling financially, the reality is that they want to take care of their children. Like I said, during COVID, I personally engaged in studies where we spoke to families and mothers dealing with food insecurity. And the average South African mother is shielding her child from hunger, is, going hungry for long periods on end to ensure that her kids do have all of the nutrients in the house, even if that's not sufficient. And I think that's very important for us when we have this discussion, that we have it with the level of compassion that it requires. And that, and I'm happy you mentioned it, because I think this is something that pops up often. But those are really the outliers. Like I said, the average South African effectively wants to feed their family, have a job, and live with dignity.
Yeah, because I'm certain that, some of the listeners post this discussion will raise that. Dr. Pereira, could say your take on that issue?
Yeah, I also think we need to look back at the underlying causes. Why do we have such high rates of alcohol use, drug use, smoking in South Africa? And it's related to people are desperate, they're stressed, they are resorting to, desperate measures because they can't cope with everything that they're faced with. And if we start addressing these underlying issues and supporting families to be able to access jobs where they are not earning below the minimum wage will start addressing some of these underlying problems, but it's going to take time. Also, we know that there's over 2.5 million children that are eligible for the child support grant but are not getting it for reasons I mentioned earlier, that they were unable to get to the Department of Home Affairs to get the birth certificate within 30 days and then go to the Department of Social Development and then go to wherever they needed to go to get the actual money. So improving the efficiency. So you mentioned that the child support grant might be being misused, but there are millions of families that are not even accessing it. So again, we need to think of the bigger picture, and we've been talking a lot about mothers and women. We know that fathers, and I'm generalizing here, but we need to ensure that fathers also take responsibility and are present and are contributing. The responsibility often lies with the woman because she has had the reproductive role of giving birth to the child, and it's very clear that that child is her responsibility. It's less clear sometimes who the father is or where the responsibility lies, and that's getting into social issues. And we're not being judgmental here. We're just trying to look at the bigger picture and not place all of the burden on struggling families, who most families do want to do the best for their children. They resort to practices like using a child support grant to pay for drugs and alcohol because they're desperate. It's not because they are wanting to neglect their children. They're just faced with so many pressures and stresses. They're in debt. There's high crime rates, and it's all related to social issues that need to be addressed as well.
I'm out of time, and I quickly want to stick with you, and then I'll end off with Dr. Kruger. Dr. Pereira could say you've been also doing a lot of work in the space of baby milk formula. This, of course, has been a contentious issue for some time, and some of the research by yourself and other colleagues at UWC and others have been saying and cautioning parents against just going the baby formula route. And of course, you're potentially talking to a segment of the listenership in the market that can afford to buy baby formula. And so I want to understand what, in a very short summary sense, what is the concern with just going the baby formula route?
So, I'll try and be short because there's many issues. It is expensive. Well, firstly, breast milk contains antibodies that you cannot produce in infant formula. So I'm not going to go into all of the benefits of breast milk, but again, going to the economic case, it would cost less money to support women to be able to breastfeed than to ensure that families can buy infant formula, which is expensive. But the cost is just one aspect. Making up infant formula so that it is safe and adequate and nutritious is also a problem. And there's a lot of research to say that a family might buy a tin of infant formula, then run out of money, they might dilute it, but also it needs to be made because it's got nutrients and we have issues with safe water access. There's a lot of research to show a lot of the formula becomes contaminated with bacteria, and that makes the child sick. Or if it's not mixed adequately and it's over diluted and it's got too few nutrients, it will fill up the baby's stomach, but it will not provide nutrition, so the baby will become malnourished. And the challenge is that these companies market the products as being equivalent to breast milk or even better and containing all of these fancy ingredients, and women go onto social media and they are flooded with adverts of formula by companies, and they think, again, they are desperate, they think this might help, and they start giving formula. It can interfere with breast milk production, and as I said, there are many challenges around this, but there are many reasons why giving formula can actually introduce harm, and there's higher rates of morbidity and mortality in formula-fed babies, basically.
All right, Dr. Kruger, we'll end off with you. Just some summarizing thoughts, I suppose. You can pick up on the last question if you so wish around baby formula, but I want to end off with you perhaps highlighting the necessity for an all-of-society approach here to deal with, if it's anything from malnourished kids, dying because they're hungry, and, poverty being such a key player here, to sometimes poor diet habits that lead to obesity within children that, sets them on a course for a life that is going to be, I suppose, a lot more complicated than being healthy, together with, other, I suppose, challenges around just general public health care and what is available. So maybe just your summarizing thoughts as we conclude our discussion here this morning.
Yes, thank you. I think that's a wonderful way of summarizing this and saying it's a whole of society approach. And, sticking to the topic of food, I think we need to understand how important accessing adequate, and with adequate I mean enough, but also good enough food is for diets, not just for young children. Of course, that is very important and a key area of intervention, but throughout our lives, we're seeing now that in South Africa, 1 in 2 people are dying of what we call non-communicable diseases, which is highly related to our diet. And in that, we need to debunk the myth that it's a personal responsibility issue. In that sense, we've discussed a lot of drivers now for why children are suffering and even why parents are potentially not being able to take care of children to the extent they need to. And we need to apply that same mindset throughout. So when we see, people struggling with overweight and obesity, we need to understand that it's becoming increasingly difficult to access healthy food, to understand what healthy food is. There's a lot of misleading claims on products. We're seeing a lot of imports, especially from the global north, of ultra-processed products that's displacing local diet. So as a whole, as a society, we need to start being very critical of what we're eating, because that is why we're seeing more heart disease, more cancer, more diabetes, more cholesterol, to the extent that it's now surpassing HIV and AIDS in terms of seriousness.
And so a lot of work certainly to cover. Thank you very much for having joined us here this morning. Dr. Petronell Kruger there to the end. She's the program's manager at Healthy Living Alliance. Also, Dr. Katie Pereira-Kutse was on the program. She's a dietitian by training with a PhD in public health. She's part of a part-time research consultant with the South African Medical Research Council, working on advocacy and policy for infant and young child feeding and nutrition. The statistics show 155 children under 5 have died in public health facilities with severe malnutrition as the underlying condition. And severe malnutrition is just another way of saying they died because of poverty, because of food that's not available. They're dying of hunger, essentially. And the stats by those that work within the industry saying that is woefully underreported, that the number is much larger than that. And that should give us some sort of an impetus to recognize and realize that in this country there are people dying from hunger. That in as much as, yes, sometimes our aid programs respond to crises around the world, equally this should move us, and we need to begin to find innovative ways to ensure that that either kids have and are receiving the necessary nutrition that they so do require, but also that we deal with social issues, the drug abuse, the neglect of kids, that is a factor in all of this, and other underlying issues as well. So happy to facilitate some of your perspectives and views on this. You can give us a call in at 1-699-1786 or use the WhatsApp line by sending us a text or a voice note to the WhatsApp number 0786 10 11 12.
Hip hip hooray! Come and celebrate Pensioners Day every